I think everybody knows what the solution is. Of course, we need to help GMH.
Guam Regional Medical City spokeswoman Cindy Hansen tells KUAM that the hospital was on divert status as of Tuesday morning this week, as a result of Guam Memorial Hospital reaching saturation. And Hansen says this has been an on and off situation for the last 6 weeks. GMH Lillian Posadas explains the divert status at their facility.
The divert status is only a 2-hour window to give our emergency room time for the doctors to say, okay, these patients are ready to be discharged or ready to go up to a room, so that way it opens up some beds.
When both GMH and GRMC are on divert, the ambulances are set up to begin going one-to-one at the emergency room locations, meaning GRMC takes a patient and then GMH takes the next patient. Posada says the reason for the recent overflow is
primarily the patients that come in, their conditions are so serious, they need an intensive care bed. Primarily cardiac and respiratory conditions are what we're seeing.
GMH had multiple patients in need of cardiac monitoring beds, but the entire third floor had reached capacity, and lack of beds is not the only challenge the hospital faces.
It's been tough. It's been hard on the nurses. They're working 12 hours, and some of the nurses, sometimes when they're off, we call them in if they can help out.
Lack of hospital personnel, that is the challenge Guam's healthcare faces entirely. Specifically for GMH, they have a shortage in critical care nurses, and altogether the hospital's latest report shows a vacancy rate of 15%. Noticing these challenges, Health Committee Chair Therese Terlahi says she was at the hospital the other day.
In the ER waiting room, and it was full, and the people, they were very sick. So it is a very important issue. I think, we have to address the nurses. We also have to address the facility.
Senator Terlahi says the critical and most urgent component is the nursing shortage, but has also made the necessary facility repairs a priority.
We all know we need to either improve the hospital or build a new one, and of course take into account the growth in population. It's always going to be a continued challenge, right, that we either have to build more, grow more as our population grows. But so the facilities, I tried to make that my priority, is to help GMH to address their facility issues, because regardless of what we do going forward, build a new one or expand this one, the existing facility has to serve our needs now, and we have to take care of these patients. They're critical.